We occasionally observed patients with peculiar, sustained, often painful shoulder elevation postures that were occasionally associated with cervical involvement or with involvement of the trunk. Some of these patients also had irregular tremors, more commonly in the ipsilateral limb, or alternatively in the head. We tried to systematize these pleomorphic presentations and reviewed a series of more than 6,000 patients that we followed for more than 20 years. This rare presentation constitutes a unique syndrome with recognizable common features. Specifically, these patients had a painful postural abnormality with shoulder elevation and no identifiable cause. All our patients received a diagnosis of functional movement disorder according to current clinical criteria. A review of published cases also showed that similar presentations have been occasionally reported over the last 30 years. We identified 19 earlier publications describing a total of 75 patients with these clinical characteristics. Sustained shoulder elevation was emphasized in some of these cases, but not in all. Some earlier patients were considered to have a functional variant of cervical dystonia or of truncal dystonia. Sustained shoulder elevation, often painful with no justifiable cause, is an important red flag for this diagnosis. The patients may develop a relevant functional impairment, and the treating doctors are often prone to consider a disabling organic condition. We hope that this publication, refocusing the clinical syndromic characteristics, may facilitate an earlier recognition of the sustained shoulder elevation syndrome.